Something is happening inside your mouth and nobody warned you. It tastes like you've been chewing on a handful of loose change. You haven't eaten anything metallic, haven't touched anything strange. You're 6 weeks pregnant, sitting in your kitchen, completely blindsided. This is the part nobody puts on the cute announcement cards. Nobody hands you a pamphlet that describes what's actually coming, not the dramatic, well-documented symptoms, the specific, quiet, deeply strange ones. The symptoms you've heard about, morning sickness, fatigue, cravings, you were expecting those. But there are 5 others that arrive without warning, without explanation. They don't make it into the glossy pregnancy books you've been reading. They don't get the soft focus scene in the movie. They just show up while you're brushing your teeth or climbing the stairs, and you have absolutely no frame of reference for them. So let's change that right now. We're going to walk through 5 of these symptoms one by one, not to scare you, to actually equip you. Because when you understand what your body is doing, something important shifts. The fear quiets down, and something else takes its place. It's not just relief, it's something closer to real awe. Your body is capable of things that should genuinely astonish you. And once you understand the mechanics behind these strange sensations, you'll see exactly why. The first one starts before most people even know they're pregnant. Somewhere around week 6, a strange flavor settles into your mouth. Metallic, flat, persistent, like a coin is slowly dissolving on your tongue. You brush your teeth and it comes right back minutes later. You drink water and it makes absolutely no difference at all. You start to wonder if something is genuinely wrong with you. Nothing is wrong. Your body is just rewriting its own chemistry. This symptom has a name, though most people have never heard it. It's called dysgeusia, and it's one of pregnancy's earliest and quietest signals. It can appear before you've even missed a period, before the test, before the confirmation. Your body already knows, and it is telling you in one of the most specific ways it can. Here's what is actually happening beneath the surface. When pregnancy begins, your estrogen levels don't just increase, they surge. They spike dramatically within days of conception, and the effects are immediate. Most people think of estrogen as purely a reproductive hormone, and it is. But estrogen has jurisdiction over far more than reproduction alone. It influences your mood, your metabolism, your skin, and your senses, including, critically, your sense of taste. Your taste receptors are exquisitely sensitive to shifts in hormone levels. When estrogen floods your system, it essentially hijacks the interpretation process. The signals your taste buds send get filtered through a new chemical environment. Flavors that once tasted completely normal now carry a faint metallic edge. Plain water starts tasting flat, strange, and almost chemical. Your morning coffee, which you loved, may suddenly taste entirely wrong. And through all of it, that low-level metallic hum never quite disappears. Some women describe tasting it even when they're not eating anything at all. The good news is that this symptom almost always fades by the second trimester. As your body adjusts to its new hormonal baseline, your taste receptors recalibrate. The world starts tasting like itself again, slowly, and then all at once. But for those early weeks, you're living in a world that's been subtly rewired. And estrogen is the one holding the controls. The second symptom shows up in your bathroom mirror one morning. You spit out your toothpaste and notice a streak of pink. Your gums are bleeding and you haven't changed a single thing. Same toothbrush, same technique, same routine as always. And yet there it is, a faint, alarming blush of red in the sink. This is the moment many pregnant women quietly begin to panic. They assume they've suddenly developed gum disease overnight. They haven't, but something equally significant is happening inside them. During pregnancy, your body produces approximately 50% more blood than usual. Take a moment with that number, because it's genuinely extraordinary. Half again as much blood as you normally carry, created rapidly and from scratch. Your body needs that extra volume to supply the placenta, the uterus, the baby. But all that additional blood has to go somewhere, and it goes everywhere. Your blood vessels expand under the pressure of the increased volume. Your tissues swell slightly, including the soft, sensitive tissue in your gums. Those swollen gums become hypersensitive, reactive to even the lightest pressure. A soft toothbrush becomes enough of a trigger to cause bleeding. Dentists have a clinical name for this condition, pregnancy gingivitis. But because nobody mentions it among the expected symptoms, it catches people off guard. The panic is understandable. Bleeding from your mouth is genuinely alarming to see. But in this context, it is evidence that your body is doing something remarkable. Your circulatory system is expanding to sustain another life inside yours. Your gums are just one of the most visible places that expansion shows. What you can do is practical and simple. Switch to an extra soft toothbrush and use it with real gentleness. Let your dentist know you're pregnant so they understand what they're seeing. The bleeding usually eases as your body adjusts to its new blood volume. It doesn't disappear overnight, but it does fade. Once you understand why it's happening, it stops feeling like a crisis. It starts feeling like evidence of how hard your body is working for you. The third symptom is the one that sends people to urgent care. You're not exercising, not exerting yourself, not doing anything dramatic. Maybe you're climbing a single flight of stairs, carrying nothing, or standing in the kitchen doing something entirely ordinary. And suddenly, you cannot get a full breath in. Not like you're choking, just shallow, just constrained. Like the air is stopping somewhere before it fully arrives. Because in a very literal sense, something is stopping it. Understanding what that something is requires understanding how your body is arranged. Your uterus begins in your pelvis, small and contained in its normal space. But as pregnancy progresses, it grows, and it can only go upward. By the third trimester, it has expanded dramatically in every direction. It rises into the space your other organs have always occupied. And one of the structures it presses against is your diaphragm. The diaphragm is the dome-shaped muscle that controls every breath you take. It contracts to pull air in, and it relaxes to let it go. For your entire life, it has had plenty of uncontested space to do this. During pregnancy, it gets physically pushed upward by approximately 4 centimeters. 4 centimeters applied to the muscle controlling every breath changes everything. Your lungs simply have less room to fully expand inside your chest. Every breath is working against a compressed and contested space inside you. You are not imagining the shortness of breath, and you are not anxious. You are geometrically constrained by the changing architecture of your own body. Your stomach gets compressed, which is why eating just a little fills you up. Your esophagus gets squeezed, which is why late pregnancy heartburn becomes relentless. Everything that had its settled place has been asked to move, all of it making room for the person you're building from the inside. What helps is as simple as your posture and your positioning. Sitting upright and sleeping at a slight incline gives your diaphragm more room. It doesn't solve the geometry entirely, but it helps you breathe through it. The real shift is in understanding what's happening and why. This isn't a malfunction. This is your body rearranging itself for someone else. The fourth symptom has a name that sounds like a joke. People in the pregnancy community call it lightning crotch. And if you haven't heard that term before, just wait. It earns it. You're going about your normal day, walking, standing, doing something routine. And then a sharp electric sensation fires through your pelvis without warning. It's gone in under a second, but it stops you completely. You pause, one hand on the nearest surface, trying to understand what happened. It was startling in a way that's genuinely hard to describe afterward. And almost no one mentions it until you're already in the middle of experiencing it. People describe this sensation in 100 different ways. A jolt, a zap, a flash of electricity, a nerve being struck from inside. And some describe it like a guitar string plucked deep inside the pelvis. That image, strange as it sounds, is surprisingly close to accurate. Here's what is physically happening when this occurs. As your baby grows, they are constantly in motion, stretching, shifting, descending. Their limbs reach outward, their position changes, their head drops lower into the pelvis. And your pelvis is threaded through with nerves, more than you might expect. The pudendal nerve, the sciatic nerve, the obturator nerve, all running through that space. When the baby moves into contact with one of them, the signal travels instantly. Not metaphorically, not approximately, literally, directly. Physically makes contact. That signal reaches your brain as a sudden and sharp electric flash. You didn't cause it, and you can't reliably prevent it from happening. It is simply what happens when a growing baby inhabits a nerved and complex space. Importantly, lightning crotch is not a warning sign that something is wrong. It doesn't mean your baby is in distress, and it doesn't signal labor. It means your baby is active, and your nervous system is responsive. Both of those things are exactly what you want them to be. Some women find that shifting their position reduces how frequently it happens. A small change in how you're standing sometimes moves the baby's position slightly. And with that shift, the pressure on the nerve releases. Lightning crotch is one of the most startling experiences pregnancy delivers. But once you know what it is, it becomes something you can recognize. And recognizing it, knowing what it means, transforms startling into reassuring. The fifth symptom is the hardest to explain to the people around you. You walk into a room and smell something overwhelming. The person standing next to you notices absolutely nothing unusual, but you're nearly knocked sideways by whatever is hanging in the air. The coffee you loved is now unbearable and nauseating. Your partner's deodorant, which was always fine before, is suddenly too much. The neighbor's cooking from 3 floors up has somehow found its way to you. It feels like a superpower, but one you absolutely did not sign up for. This symptom is called hyperosmia, and it's one of the least discussed in pregnancy. Your olfactory receptors, the nerve endings that detect scent, become dramatically more sensitive. Some research suggests the sensitivity increase can be as high as tenfold, 10 times more sensitive than you were before pregnancy began. Smells that once registered quietly at the edge of your awareness now arrive at full force. They come with texture, with weight, with a kind of insistence you can't push past. The theory behind this is rooted in deep evolutionary biology. Before your conscious mind catches up to what's happening, your nose steps in first. In early pregnancy, your body becomes acutely sensitive to things that pose a risk: rotten food, harmful chemicals, environmental toxins. Your nose flags them before your brain does. The smells most likely to trigger nausea often carry genuine biological risk: meat, alcohol, certain cleaning products, things your body wants to keep its distance from. Your sensitivity isn't a glitch in the system, it is the system working perfectly. But living inside it on a daily basis is genuinely hard. A stranger's perfume across the room can ruin your entire afternoon. Garlic cooking nearby can send you straight out of the room. Even a scented candle in the next space becomes an event. What helps is surrounding yourself with fresh, clean air whenever possible. Switching to unscented products reduces the daily sensory overload considerably. And being honest with the people around you matters more than you might think. You're not being dramatic. You're experiencing the world at a different frequency. As the second trimester begins, this heightened sensitivity typically starts to ease. Your hormones stabilize, your nose recalibrates, and the world stops arriving at full volume. Here's what ties all 5 of these symptoms together. Every single one is your body doing something extraordinary. The metallic taste is estrogen rewriting your sensory chemistry from within. The bleeding gums are your circulatory system expanding to sustain a second life. The breathlessness is your organs physically relocating to make room for someone new. The electric jolts are your baby making contact with the nerves of your pelvis. The overwhelming smells are your biology deploying its oldest protective instincts. None of these are signs that something has gone wrong. They are signs that something profound and irreversible is going right. Your body is not malfunctioning. It has simply never done this before. It is building a person from raw material, from inside itself. And that process is going to feel strange and uncomfortable and surprising at times. That is not a flaw in the design. That is the design. We talk about so little of what pregnancy actually feels like from the inside, especially the specific, quiet, startling parts that catch you completely off guard. So if you're in one of these moments right now, hear this clearly. You are not broken, you are not imagining things, and you are not alone. Your body is doing the most complex thing it has ever been asked to do. It is doing it without a manual, without a pause, without a blueprint. Understanding what is happening gives you something that no pamphlet ever can. It gives you the capacity to trust the process you are inside of. And trust in pregnancy turns out to be the thing that carries you through.